Our next speaker, Dr. Terry Lehenbauer. Really pleased he's here. He's based his career in food supply veterinary medicine with really an emphasis on dairy cattle production medicine and herd health. He's a graduate of Oklahoma State University. Spent some time at Oklahoma State, I believe 13 years, but prior to that he was in practice and was an owner in a dairy practice in California. So he's now at UC Davis Center for Food Animal Health, and his research interests include respiratory disease, heat stress management for dairy cattle, and animal health economics. So, Terry, we're glad you're here.
All right. Thank you, Dale. Again, like the other speakers, I want to thank the program committee for allowing me the opportunity to share some information with you, and I especially want to thank the Academy for their indulgence to allow a few of us that have more of a dairy cattle interest to be involved in the program. And so, the main things I would like to cover during the time that I have is to kind of give you a perspective about large dairy herds and large dairy calf operations and the changes that are occurring in the population dynamics, the importance of economies of size and scale and the way it affects those operations. I want to talk about prevention and its importance and stress that aspect, and how that fits with prevention of BRD in particular. And then a systems perspective or approach for trying to achieve the goals for preventing and controlling BRD. So as Dale mentioned, I'm currently have the opportunity to be at the UC Davis Veterinary Medicine Teaching and Research Center in Tulare. And so we're a short 240-mile commute southeast of the main Davis campus. And it's amazing how many people, even in the local area in Tulare County, don't know that we exist. So I guess we need to probably hire a PR firm, perhaps, to get the word out. But anyway, our focus there is dairy cattle herd health and production medicine. And I'm giving you this background because that represents, I'll provide some data and some information, but I'll also share with you some of my knowledge that I've gained through my observations as a practitioner and as an academic clinician. And also that will include some of my biases. And as epidemiologists, we know that bias is just a word that we define as systematic error. So that's a bit of a disclaimer. But on the background on the Tulare, to give you a perspective of where I come from, is back in the 1970s, the regents at the University of California had the vision and foresight to know that the dairy cattle population would not remain in the Davis area. And that's true. The dairies have basically moved away from Davis, but they located our center in Tulare County, which is in the central San Joaquin Valley. And that pink area on the map represents the San Joaquin Valley area, which is the largest dairy cattle concentration in the state, that represents more than 70% of the total dairy cows in California. And just some of the numbers, so we have over 20% of the total dairy cow population in California. And Tulare County is also the #1 dairy county in the nation as well. And you might notice our herd sizes for California, based on the most current California Department of Ag data, is the average herd size for the state is over 1,100, and for Tulare County is over 1,700 cows. And obviously there's a direct correlation with the cow herd size and the size of the calf operations on the dairies as well as the calf ranches in these areas. So what is a large herd or a large population when we talk about dairy cattle? So, we all, I think, appreciate and understand that we have dairy farms in the United States that are well over 15,000 head. Double that size is probably the upper limit. But most commonly, we have large herds that are in that 1,000 to 5,000 range across the country. USDA typically will look at dairy cow herds with more than 500 cows as being classified as large when they do their statistical collection and reporting. And we've seen trends that have been going on for quite a while. So this is some older data, but it shows the trends where these are looking at percentage of dairy cows by herd size, and we see a decline in the small herds and a growth in the large herds. And if we look at number of herds, so if we look at the smaller herds less than 500 heads, again, there's a remarkable decline that's continuing through today. And equally important is the similar increase in the number of herds with large number of dairy cows. And so that trend is continuing. And so a little over 2 years ago, back in March of 2012, we reached the point in the United States where over 1/2 of our total milk production comes from dairy herds with more than 1,000 cows. And so I think that really is important for the long-term perspective for us as veterinarians, that over time and in the future we will be working more and more with larger herds that will have larger calf operations. As far as calf ranches are concerned, I guess, as Dale mentioned, I grew up in Oklahoma and went to veterinary school there and had the privilege to have Bob Smith and Dee Griffin be my faculty in food animal, as well as Roger Pansier as a pathologist. And so, we had small dairy farms there, and this phenomenon of calf ranches was something that I didn't really know or appreciate until I came to California. And so, because of the concentration of dairy cattle, particularly in the San Joaquin Valley, we have a significant number of very large dairy calf raising operations or calf ranches. And they will range in size from a few thousand head to up to 80,000 head. And so that starts to look like a feedlot with miniature cattle in it compared to the beef model. And it's important, I think, to keep in mind when we start looking at these large operations of calves that there is, at the same time, there's a opportunity as well as increased risk that exist. And it's basically due, as I think of it, as the multiplier effect. So when you're working with a large operation that has several thousand or 40,000 or 80,000, a fairly simple decision such as whether am I going to use a 2-way or a 3-way intranasal vaccine now becomes a pretty significant economic choice, both from the cost as well as the impact that the vaccine may or may not have on calf health and performance. So if your multiplier is 10,000 or 40,000 hutch calves, it can be a big deal. So I think we're all pretty familiar with this concept of economies of size, and it basically, when we look at it from an economic perspective, it's usually more formally thought of from the economic perspective as the volume buying discount. So when you're a large operation, you certainly have the opportunity to get the best price for buying your inputs for your feed, for your vaccines, for your drugs, and for your other inputs. And that's certainly a really important factor, and that helps to support these larger operations. But I think the thing that we probably don't think of as much in comparison is the economies of scale. And economies of scale, at least again from the economist's perspective, is that really refers to the specialization of labor. And so as these operations get larger, the labor force gets more specialized, where they have more specifically assigned jobs and responsibilities on that operation. And if it's properly done, it provides the advantage of better quality, better results, and more efficiency. And again, as I referred with the multiplier effect, if it's done poorly, you can have an equally serious negative outcome. And, so a good example on these larger calf ranches would be the treatment crew, or the people that are, for example, assigned that their whole job, all they do, will be walk by the hutches and look for sick calves that need treatment. And typically it's predominantly either GI disease in the younger calves or respiratory disease in the older calves, but that's all they do. So they're not responsible for feeding or for doing any other jobs on the calf ranch. All they do is find calves that need treatment and treat them. At one of our large calf ranches, that's one of our clients at the center, I guess the best example of this specialized labor is they actually have a crew of carpenters at the calf ranch. Their only job is to repair the calf hutches, and that's all they do. So I think Mark Hilton did a great job when he started us out yesterday, that we always need to have the right perspective on why we're trying to raise these calves. And if we're talking about replacement heifer calves, we really need to think about healthy cows that will make and contribute to a productive milking herd. If we're looking at the bull calves, then we're looking obviously at healthy and productive steers that we're going to put into the beef supply side. And I guess I forgot to mention on the large calf ranches, obviously one of the reasons why these calf ranches came about was because, until the advent of sex semen, basically half the calves were bulls, and dairies basically don't keep bulls or very few. So there was a need for something to raise these bull calves. And so that was one of the big pushes for development of these calf ranches. And some of the calf ranches do also provide contract heifer raising as well. So I think in general, like most of our clients, they are motivated at some level to try to hopefully achieve or approach a optimal health and growth outcome and performance. And I think in general, obviously there's lots of variation, but they achieve typically some level of satisfactory performance or better perhaps if they're good. And like anything else, there's a variation and a distribution. But at the same time, if there's problems with the system or the management or other factors, things can decline pretty quickly. And as Walt Guterbach mentioned in his presentation, that one of the things about calf raising is that things can change very quickly. And so if things are not going well, you can quickly have unacceptable outcomes in both health and performance, and also have concerns with welfare when there's increased morbidity and mortality. So the major objective, I think, when we talk about BRD is control, but I think it's probably actually better to think of it as prevention. And we want to prevent BRD, and I'll go into more detail about the aspects of prevention. But it's been well documented by several of the speakers over the last day and a half that BRD is one of the most important diseases of calves, of dairy calves. It's the number one cause of death in weaned dairy calves, and it's the second leading cause in pre-weaned dairy calves. And so when we think about prevention, we can actually look at it a little more detailed and think of it in four levels or four areas. And so kind of the pinnacle is prevention of infection. And so that's what we would always like to achieve, is to not ever have the disease to be present or to cause an infection, and so that we completely prevent it. And that's a fairly lofty goal, but that's the ultimate goal. The second level, or secondary prevention, is where we have disease present at a level where there's subclinical disease, and so we're trying to prevent it from developing into recognized clinical disease. The next level of third level or tertiary is to prevent clinical disease once it becomes recognized from becoming a more chronic or a more severe disease. And so obviously when we think about therapy and treatment for BRD, we're probably dealing somewhere either in the secondary or tertiary levels of prevention, depending on how we're detecting or diagnosing cases. And then the fourth level is basically we're at the situation of a call or euthanasia. And at least for me and my perspective is that what we're really wanting to achieve at that level is to prevent welfare compromise of the animals, do what's in the best interest of that animal. I think in the time that I've had to be involved with some of these large calf ranches, I think I'm continually impressed with the importance and significance of good sanitation and hygiene for these young calves. And It's not very exciting. It takes a lot of work and consistency. And so this picture just shows a situation when the calves are weaned, and it varies a little bit by ranch, but this particular ranch usually weaned around 68 to 72 days. The calves are all removed. The hutches are tipped up. They're scraped. The floors are scraped to remove the gross accumulation of manure. And then they're pressure washed. And then they're allowed to dry in the sunlight. And then they're whitewashed. And then new calves come in after that process. Sanitation is also important for every aspect of the feeding and nutrition and the water buckets and all those things. And I had the opportunity about 3 years ago. Our clinical group at Tulare was able to do over 200 dairy herd evaluations for the National Farm Program. And that if you're familiar with that program, you evaluate all the animal groups at the dairy farm, including the calves if they raise calves. And so it was a neat opportunity to go to a lot of different dairies and see different systems and facilities. And so you'll notice after you get the opportunity to do these that there is noticeable variations in degree of sanitation and hygiene that exists at different dairies. And so it's really important. There has been some mention during our program about the contribution or influence of colostrum on BRD incidents. And again, back on the 2,000 head case control study that we did, that particular calf ranch did bleed calves at 2 days of age and measure total protein. And if we use a cutoff point of 5.2 grams per deciliter, there was a significant association for the odds ratio with a value of 1.3 for cases having a low cutoff compared to the controls. So it was significant. I know both DL and David gave some good information related to immunization programs, and so I really liked what DL had to say, that I think every program needs to be kind of a custom program and to fit the needs of the operation and the constraints and the management objectives. And but there's several basic factors that we always consider in designing that custom program, and I think one of the more important factors perhaps is the timing. And again, from our case control study, where again we were working with pre-weaned calves, and on over 2,000 head that we sampled with deep pharyngeal recess swabs, we did not find any evidence of pathogens for IBR or BVD. And that does kind of match Mark Thurman, Dr. Mark Thurman, who was a faculty member at Tulare earlier years, did some studies to try to estimate or measure exposure to BVD. And his data showed that he didn't start getting significant scientific evidence of exposure till about 90 days or older. And so I guess, what we found matches at least with what the information that Dr. Thurman saw in his study from several years earlier. I think it's important to have ongoing surveillance programs, particularly at these large calf ranches. So for the one calf ranch that we have as a regular client, they bring 6 dead calves to us every other week for necropsy examination. And they select the calves that they think are representative of the current problems that they're having at the ranch. And I think that's important. And I think it's also, with some of the information that we're gathering with swabs and some of the work that we're doing, that may be another tool that we need to think about for getting information from live calves, and not waiting for calves that either have to be euthanized or die. And I guess it's kind of an anecdotal point. I've been involved with some colleagues at meetings or on committees, and during the breaks we discuss what we do, and I'd share with them that that we have these large calf ranches, and the one that's our client will routinely have death losses less than 3%, and in good conditions they'll approach 1% mortality rates. And I think that's pretty amazing, at least in my thinking, when you consider that about somewhere between 60 to 70% or higher of those so they're all bull calves, are colostrum deprived. And so I know I've had colleagues say, well, if they're colostrum deprived, they're going to die. And clearly we're not saying that you shouldn't get colostrum into those calves. But I think, again, with good sanitation and hygiene and good detection for early detection and treatment of cases, you can have really good outcomes with really good management systems with well-trained workers to care for these calves. So I think BRD prevention is important, particularly, again, in the area of secondary and tertiary prevention, to try to have quick and accurate detection of cases so that they can get appropriate treatment. And I think, as Dr. McGurk shared yesterday, as well as my colleague Dr. Ali, that I think the scoring systems can play an important part in that effort to have that quick, accurate, consistent detection of early cases. And as Dr. Robert Corbett mentioned during his presentation yesterday, I would completely agree with the points that he made about the very important aspect of proper nutrition for these calves. I guess I'm kind of embarrassed to say that it seemed like it took us about 20 years, at least in the area where we were in California, to figure out that in the wintertime, when we had cooler temperatures and more environmental challenge, that we were actually starving calves. Calves would get sick and die. They'd come in for necropsy, and the pathologist would do the examination and find that there was complete serous atrophy of all the fat. And it took a long time to get that understanding in place and to get that message out. And so I think we've solved that problem for the most part. But I think we're now at the next threshold to say, well, maybe, and again, as Dr. Corbett mentioned, what is the optimum nutrition? We can at least maintain them and support some low-level gains, but what would be the optimum, both in terms of performance and in terms of calf health? And so I think, nutrition is not only important for, the growth and performance, but, we keep finding out more and more all the time about the role of different aspects of nutrition and minerals and vitamins for the immune function and immune response that can be very important as well. Environment plays, I think, a big role in calf performance and health, and it plays an important part in BRD. I think the principle of avoiding overcrowding and mixing of different ages in the group pens once they leave the hutches, I think we've known about that for a long time. Now, I think, like everything else, we seem like we have constraints working with clients to see how do their facilities accommodate this need. But whenever we violate it, or at least violate it to a significant extent, we usually pay a price for it. And so I think it's really important that we follow that principle. I think there is a need for additional research to develop improved housing and environmental management systems for calves. And I guess I would make the other disclaimer or caveat in my presentation that, I think environment is a big difference across the country, obviously. And so our housing systems that we have in California wouldn't work in climates that have a more cold weather problem or issue that we don't have in Central California. But I think even in California, where it's generally mild, at least compared to other parts of the country, we do have a hot, dry climate in the summer. But I think we need to look more at the housing needs. I know there's research that's ongoing to look at different kinds of housing design, and we're all aware of the challenges that are coming about providing good quality animal welfare. And I think we're probably okay with our systems, but I don't know that we're where we need to be as far as looking at the future. And so I think that's a need and an opportunity that we need to look at. And then finally, I think because there is a complexity here with these large calf operations, we need a systems approach. So we can't just look at one thing in isolation and expect that to solve all of our problems. So we have to look at everything together and see how it interacts and contributes to the overall outcome. And so we need a good record-keeping system and analysis of those outcomes. And surprisingly, or at least to me, on these large calf ranches, you're seeing the record system. You might need to look carefully, but if you look on that top board, the white, there's a 16 with a circle around it, and then there's a couple of tick marks on the other side. That's the health record for that calf. And so it's reasonable to think that when that calf leaves and it gets cleaned and whitewashed, that record goes away, right? And so I think there's a big opportunity here, and I guess, part of that responsibility, I think, is on us as veterinarians to help our clients and our producers see what that opportunity might be and how they might benefit from it. But I think that is a real important need. There obviously are some systems that are being developed that use some technology that maybe make it easier and more efficient. Electronic systems combined with electronic IDs could be very helpful. And this is just showing, the electronic ID ear button and using a electronic reader that will record the calf ID, and then with the automated system, it would be easy to put in, what the health condition might be and what treatment is being given, and then that data could be downloaded and stored and analyzed from the computer. So I think if we can achieve better record keeping and analysis of outcomes, then we can, one of the needs is, are we achieving the level of performance that we want to obtain? And that gives us the opportunity to document that. It allows us the opportunity to identify the new problems that are developing and, to be proactive in recognizing those and determining that they're significant enough that we need to do something about it. And then I think another important part that's always a challenge is procedural or protocol drift. Sometimes, human nature, we tend to get lax. Things change, or new workers are hired, and maybe we thought they got properly trained, or we just need to follow up. And so I think the records and systems approach plays an important role in making that happen. So in summary, obviously I think it's clear that the national dairy herd population numbers are changing in terms of herd size, and therefore the size of the calf raising operations are changing, whether it's at the dairies, those larger dairies, or at calf ranches. I think the specialization of labor on those larger calf populations is a really important factor to be aware of and to try to take advantage of that to make it work better. Prevention should be the focus at all the different levels, hopefully working at the top end and not so much at the lower end. But, a systems approach with the proactive surveillance system in place to be able to collect the data and be able to detect changes in an efficient manner, I think, are important for having a good operation. And again, the fundamental aspect of that is a better record-keeping system and analysis. And then just kind of a closing comment that why I think all of this is important is because of the need and the challenge that we're all facing being involved in animal agriculture, of cattle production, that it's been projected in 40 years, the world population is projected to reach a level of 9 billion people, and that means that we will need 100% more food than what we're producing today. So there's a need for efficient production of healthy animals. Thank you.